Hello, good afternoon. My name is Dr. Trudy Ufondu, and today it's another important episode with understanding a couple of things about the way the body of a woman works. So we're gonna be starting a kind of a new series. It's gonna be by asking questions, some important questions. So we're gonna start with, did you know? So this evening we're going to look at the steps about IVF. IVF is as old as 40 something years. And with the advent of IVF, so many families can boast of becoming parents today. So it's a welcome development. IVF actually started in UK. The first IVF baby was Louise Brown a couple of decades ago, about 4 decades ago. She's alive. She started her own family. So the process of IVF, unfortunately, we don't want to look at the negatives. The process of IVF has actually helped a lot of people to become parents. So this evening, we're going to look at it from stepwise things you need to be conversant with. And we're going to use my good friend, the female reproductive system, to understand it better. So I'm going to take us step by step of how IVF works. It's possible you've been given IVF as your only option. It's possible you don't really understand it, maybe from a cultural perspective, maybe from a religious perspective, or simply because you don't have the full knowledge. You've been sitting on the fence, and this is your only viable option of becoming a mother, of becoming a father. I'm just trying to encourage you today to sit up and do something. The reason is because when you don't take actions, there are a couple of things that can change by the time you're ready. One of the things that can change by the time you're ready is the state of your ovaries and the eggs. So the constant is what you have, the eggs that God gave you. So if you were told you will need IVF, there is no other time to waste. Now, in the event you finish using your eggs, there are a couple of things we can still do. Remember, when you finish using your eggs, you've gone into menopause. Now, going into menopause doesn't mean you can't become a mother. You can still become a mother. But by the time you get to that menopausal stage, you can only become a mother when you go for donor eggs. But this evening, we're going to go step word IVF. We'll start freaking you out. So the full meaning of IVF is in vitro fertilization. That's fertilization instead of going inside this beautiful section of the reproductive system, which is the womb. The fertilization will occur outside the body of the woman. So the normal fertilization is called in vivo fertilization. It actually happens in a special place called the ampulla. But in IVF, it happens outside the body of the woman. Now, I'm going to try and make it very simple. Like I mentioned, it's been around for 40 years plus, and it's commonly used all over the world to help people that couldn't become pregnant by themselves to become pregnant. Now, in a nutshell, IVF simply means fertilizing the egg with the sperm in a special place in the lab called the incubator outside the body of the woman, then transferring that fertilized egg at that stage called the embryo back into the body of the woman. That's simply, in a nutshell, what IVF is all about. The whole process, if it's done appropriately and you responded okay, some women can start their IVF and finish it within 3 weeks. Some women can finish it within 4 weeks. Now, however, some other women might have a need to stop the IVF. If we have any adverse effects or any serious side effects, we can stop and continue. So it's important you understand the process properly. It's important you ask a lot of questions. Now, to start, the very first step in IVF is actually starting the treatment. That's when you begin to have the conversation. Now, during this period, they would have explained to you everything about IVF. So during an IVF cycle, when you're starting the treatment, the major aim is to achieve what we call superovulation. So in superovulation, we are desiring to have several eggs that will mature at the same time. The process of achieving this is called superovulation. Normally, the natural ovulation will lead to production of one egg. But in getting ready for IVF, we challenge the body we challenge the ovaries to yield and give us so many eggs. Now, the starting point of IVF treatment is with specific injections we call the gonadotropins. We are going to focus on FSH, which is very important. So it starts with FSH injection. FSH stands for follicular stimulating hormone. Now, FSH is actually given to help in bringing this superovulation to actually reality. So injection with FSH is something we'll teach the woman to know how to perform. Now, there is a particular aim we are planning to achieve when we start this IVF treatment. It's called pituitary suppression. So the pituitary gland is a special gland in the brain. It's actually the place that FSH, LH, and other important hormones called the gonadotropin are produced. So the major aim, the very first major aim in the process of IVF is to do what? To cause suppression in that part of the brain so that we can take over the body of the woman and do it exactly the way we want. Now, there are different types of IVF treatments depending on when the pituitary suppression will happen. Now, if the pituitary suppression will happen before stimulating the ovaries, it's called long down regulation. If it's going to happen after stimulating the ovaries, it's called antagonistic cycle. Now, the type of IVF you will go for will be dependent on your individual needs. So your specialist, your IVF specialist would have checked you and made sure that the one he will select will be the one that will work for you. Now, you have a special fertility coordinator that will be attached to you. Your fertility coordinator will provide you with detailed information about the specific cycle treatment, about the timeline and your medications. It's important you understand how to take your medications. It's important you understand the timeline. Now, you will be shown how to give yourself these injections. This is where your partner can come in. So if your partner is user-friendly, your partner will attend with you for all the consultations. We'll teach you guys how to give the injection. Sometimes you might give the injection in your belly. Sometimes it might be in your buttock. Sometimes it might be in your thigh. So we teach you how to get the injection administered. Getting the injection properly administered is very important. When we do this, it will limit your frequency to the clinic. So if your partner can give you these injections at this first stage, which is the starting the treatment stage, then you guys would have been on the same page. Now, the second step is actually the most important step. So the second step is ovarian stimulation. So in ovarian stimulation, we are now going to give you doses of FSH injection for about 9 to 14 days. The essence of giving you this injection is to stimulate the ovaries. When we stimulate the ovaries with FSH, the ovaries will start developing so many follicles. Remember that the follicle is the vehicle that contains the eggs. So the dose of the FSH will give you will be higher than the normal dose you produce naturally. The essence is because we want it to stimulate as many multiple follicles as possible. So when we are giving you the artificial FSH, the dose is going to be higher with the aim of giving us more. Now, the response of your ovary to the FSH, which is the ovarian stimulation, will be monitored by a series of ultrasound. So if you're going for IVF, there are so many ultrasounds we're going to take. We're going to draw a lot of blood work. So you have to be ready. There are constants in IVF, ultrasounds and your blood work. When we are taking your ultrasound and your blood work, we are checking how your ovaries are reacting. Now, most women at this stage would have mastered how to give themselves injections. Their partners can also come along so that the frequency of going to the clinic will be reduced. Now, in the event that the stimulation worked properly and we got so many follicles with prospective eggs inside the follicle, the next stage is what we call the trigger injection step. Now, in trigger injection step, by the time we are okay with the ovarian stimulation, we are gonna discontinue the FSH drugs and other agonists or antagonists which will work on the pituitary suppression. So once we are sure that the stimulation is going okay, and we are sure that the follicles are developing okay, we are now gonna step to the next stage. So the trigger injection will be the next thing to do. Once the coordinator has confirmed that everything is going okay, they will plan this. The timing for your trigger injection is very, very important because exactly what is mentioned is what will happen. So the trigger injection will trigger the normal and the actual release of the eggs. Remember the difference between the follicles and the eggs. So once we give you the trigger injection, then we are already moving forward. Once you get to the stage of trigger injection, you've actually advanced further in the process of IVF. Now, the injection we normally use for trigger injection is human chorionic gonadotropin. This is the so-called pregnancy hormone. So when you're checking your urine, when you're checking your blood to know if you're pregnant, it's beta HCG will check. So this beta HCG is what we'll give you to aid in the final egg maturation. Once the egg is matured, the egg is going to burst away from the follicles. Remember when I taught you guys about the function of the follicles? When the follicle is done releasing the eggs, it will go ahead and form what we call corpus luteum. Now, by the time we have succeeded in getting the trigger and the egg is released, the next thing is what? The egg retrieval. Now, your specialist will then perform the process of collecting the egg that has already been released. Very, very important. This stage is actually performed by putting the lady under sedation. Because once you are gaining access into your body, the possibility you're going to be uncomfortable and some people will feel some pain is there. When we are going for the egg retrieval, we will use ultrasound-guided probe with fine needle attached to it. And we go through the vagina, pass through the cervix, and target to get to the ovaries. The essence is to get to the follicles in the ovaries. When we get to the follicles in the ovaries, we'll collect the fluid inside the follicle. It will be extracted and put into a test tube and studied to know if we got enough eggs. This procedure will take about 30 to 20 minutes, depending on the number of follicles you are dealing with. Now, we normally advise that after this, you wait for 1 hour before you go home. So if you're coming for egg retrieval, that same day you're coming for the egg retrieval, we normally advise you wait for about 1 hour. Now, by extension, we also advise the women to take that day off and avoid strenuous exercise. It's not like all these things are going to do a lot of magic, but it gives you a lot of peace of mind. Now, on the day of your egg retrieval is also the day we'll ask your partner to bring the semen sample. Most fertility clinics will have a special room where your partner will go in there and collect the sample. The best method of collecting the sample is masturbation. Now, if for any reason, in course of collecting the sample or before then, you guys felt there might be concerns, please discuss with the staff and your fertility coordinator ahead of time so they can make alternative plans. Some people can give you some other alternatives. They might give you some special condom you can take home and collect your sample. But this is what I will tell you. My people, my sister, if you have come to the stage of IVF, collecting your sperm through masturbation should be the least of your worry. When you go about doing it at home, the possibility you're going to get wrong result is high. So allow yourself do everything within the hospital and the clinic premises. Now, by the time we've done with the retrieval of the eggs and we have the sperm ready, the next one is what we call insemination and embryo development. Insemination simply means fertilization. So this is the difference between the normal fertilization and in vitro fertilization. In vivo fertilization, the fertilization will happen in a special place called the ampulla. But in this case, insemination or fertilization will happen in a special place in the lab. So the sperm sample we collected, we are going to wash the sperm and concentrate the sperm. Then we are going to add the eggs. And we are going to, this process is going to happen within 4 hours of collecting the eggs. So when we collect the eggs and the sperm, we're going to join both of them together. Then we place it in an incubator overnight. Then overnight, we're going to look for signs of fertilization. Usually, 60 to 70% of the eggs will fertilize if the sperm parameter is good. So what do I mean by the sperm parameter? If your partner's sperm has good count, it's mobile, it's good looking, then the possibility that 60 to 70% of the eggs will be fertilized. Now, at this stage, the embryologist, which is actually the major person that monitors all this, will contact you and discuss the fertilization outcome and ask you if you have any question. So by the time you're done retrieving the egg and collecting the sperm, definitely you're going to go home. So the whole process of fertilization, you might not be there. But over time, they will call you and they will give you an update. Now, the fertilized egg will be kept in the incubator for additional 48 hours. At this stage, the fertility specialist, the IVF specialist will start discussing other options. So this is the stage they will give you the option of ITSCI, intracytoplasmic sperm injection. This particular type of IVF is very important for men that might have poor quality sperm. So if you don't have enough count, the morphology is not good, the motility is not good, ICSI is your best option. Intracytoplasmic sperm injection. So in this process, we're actually going to get the sperm and we inject it directly into the eggs. So ICSI is a specialized form of treatment for male infertility problem. So if the reason why you guys are not able to have a baby is because your partner's sperm is low, or the morphology is poor, or the motility is poor, ICSI is your best option. It's a little bit expensive, but it works. Now, by the time we've done all this, the next important stage is the transfer. So by the time we were happy that fertilization occurred and we have a couple of embryo, the next one is what? Embryo transfer. Remember that embryo is the union of the egg and the sperm at this stage. Once the egg and the sperm come together, they will form the embryo. So embryo transfer will occur about 2 to 5 days after retrieving the eggs. The embryo is chosen for transfer. It's put in a tiny plastic catheter, a soft tube, which is passed through the cervix and quietly and carefully drop in the womb. This is simply what transfer is all about. We collect the embryo carefully. We put it in a thin plastic catheter. Catheter is just a soft tube. Then we carefully go to the vagina, pass through the cervix, and carefully drop it in the womb. This process will take just about a few minutes and is very, very painless. You don't feel any pain. Now, only one embryo is normally transferred in most clinics, but depending on the protocol in the clinic where you are and the location and their practices, they can try more than one. But the possibility of trying more than one is actually dependent on the age of the woman, is actually dependent on the ability of the womb to carry more than one. But most times we transfer just one embryo. But if your fertility specialist felt you are a candidate for more than one, that's okay. So once the transfer is done, the remaining embryo can be stored for rapid freezing, which we call vitrification. So if we succeeded in getting more eggs and we succeeded in getting more embryo, we can actually keep those eggs for future use. We can actually keep those embryo for future use because the possibility that IVF will fail is there. So it's not a must that once you go for IVF, you will succeed. So in the event that the particular cycle you're going for failed, we can go back and use the frozen embryo or use the frozen eggs or use the frozen sperm. So make sure that when the frozen option is being used, we have to check for signs of fragmentation. Once we notice the sign that that embryo is not good, we are not going to freeze any bad embryo because what you give is what you get in pregnancy. So we are very careful in the process of freezing. Now, the last stage in IVF, which is very important is what we call luteal phase. So the luteal phase is the 2 weeks period between the embryo transfer and the pregnancy test. This is very, very important. This luteal phase is the support phase. So during this time, we look out for yourself, you maintain a good health, you sleep, you eat good food, you make sure you're in a good place. It's very difficult to achieve this because so many women will be freaking out at this stage. You're emotional wreck, you don't sleep, you're worried. What if it's negative? They start. So then we encourage you to go easy. Limit strenuous activity 24 hours after the transfer. Now, the major drug we normally use for luteal phase is progesterone. Progesterone is the pregnancy maintaining hormone. So we give you the progesterone to sustain you for that 2-week period before you go for your pregnancy test. So the progesterone medication is taken after retrieval just to make sure that everything is going okay. Now, in some women, progesterone medication can make you to feel very tired, can make you to have cramping or bloating. They are all expectation. Now, some women can also feel some discomfort. If you have this discomfort, you can take your analgesics, your paracetamol, that's okay. Some women can also have little spotting or bleeding here and there. If that happens, it's still okay. The fact you bled or spotted during IVF doesn't mean it didn't succeed. Most women will bleed or spot, but they will still be okay. So anytime you notice anything, please communicate with your IVF coordinator. Communication is very important. If you notice any vaginal spotting or bleeding, communicate with the IVF coordinator immediately. You should continue using all your treatment drugs as advised by your doctor. Your doctor is the only person that will tell you to stop or to continue. So don't stop by yourself. Even when you're bleeding, continue until you're told to stop. Now, eventually, by the special grace of God, once it's 14 days beyond embryo transfer, the almighty pregnancy test will come. So pregnancy test is done by checking your blood test. The reason why we'll opt for the blood test is because blood test is superior to urine test. So 14 days after embryo transfer, you go for your blood test. Your nurse will call you by phone to share the result and advise you on the next stage to take towards having your baby. By the special grace of God, by the time you get to this pregnancy test, you're going to get positive. Now, we recognize that between the time for the embryo transfer and your pregnancy test, so many women will have a lot of anxiety problems. So many women might even be depressed. So many women will have a lot of mental health issues. Remember, if you need emotional support, call the fertility and the IVF coordinator and they will support you. Most IVF clinics will have people that can talk to you. Some of them have professional counselors that will talk to you. So we understand it might be a very difficult time. So we encourage you to call your IVF doctor at any given time. Now, when you do this, you will be in a better place. So then my prayer is that by the time you come to this stage, you would have become pregnant. Now, in our organization, SGHS, our certified, verified IVF specialist will provide you personalized, compassionate care, which will support you at any stage in this IVF journey. So this, in a nutshell, is what IVF is all about. The steps: starting the treatment, starting your stimulation, making sure you're taking your medications properly, getting the eggs retrieved, providing the sperm, getting them fertilized, transferring them, and checking for pregnancy test. So these are the basic things that happen in the body of a woman if she's going for IVF. So you can see it's a guided step. So at any stage, if we have any concern, we can cancel that cycle. So some women can develop some complications. One of the major complications a woman can develop when she's going for IVF is what we call OHSS, Ovarian Hyperstimulation Syndrome. If this happens, we can cancel your cycle and we can keep an eye to make sure everything is going to go good. Now, IVF is a very expensive process, so we are not in a hurry. We don't just want to do it. We want to do it well. We want to have good outcome. Okay? So this, in a nutshell, is what IVF step is all about. Now, I'm going to give us an opportunity to ask questions. So the clinic is open. Feel free to ask your questions, and I'll provide you feedback. And I think I have a question already. Are there any side effects associated with IVF? Yes. Like I mentioned, all these drugs we are talking about can have side effects, right? So you might be moody. You might notice you sleep a lot. You might notice you're easily tired. You might notice you're vomiting. You might notice that you're not just yourself. They are all transient side effects. So how you react is different from other women. Now, some women can also notice spotting. Some women can notice mood swings. Some women can notice a lot of things at the same time. The most important thing is, anytime you notice anything that is not normal, communicate with the coordinator. So if we notice any sign that your belly is getting big, that means it's possible you're having that OHSS. So we need to confirm, we need to have an ultrasound, we need to monitor the size of the ovaries, because in OHSS, your ovaries will start getting big and it can cause a lot of problems. The key word in IVF is good outcome. So once we have a feeling that it's not going okay, we are going to cancel it. So yes, there are complications. There are mild complications that can happen. There are major complications that can happen. The major one is OHSS. Once it happens, we're going to cancel it. Okay? Very, very good question. Will IVF significantly increase a woman's chance of having twins and triplets? Yes. The reason is because when we have good embryo and you have favorable endometrium, endometrium is the cover of your womb. So assuming we got 4 embryos or 6 embryos and you have age on your side and you have a favorable endometrium, enough thickness, everything is good, your hormones are okay, we can hazard going for 2, 3, 4. This is how women have their quadruplets, triplets. Okay, so your IVF provider will be the person that will decide. So some people might be having infertility problem for 10 years, and if God is on their side, they can go and have 4 babies at a sitting. The younger you are, the better the outlook for multiple pregnancy. But ironically, you have a better chance of multiple pregnancy when you're older than 35. Then you have a better outcome if you're younger than 35. So you can see how things in life can lack a lot of balance. You can easily become pregnant with more than 1 baby, both naturally and when you're going for IVF, if you are above 35. But the ability to have good outcome is better when you're younger than 35. So the younger you are, the lesser the challenges you're going to have when you become pregnant. Okay? Very, very, very important. Okay? Are frozen eggs less effective than fresh eggs? So this is what we know for now. Because of the advancement in modern technologies, you can actually make a case for 50-50. So if a facility is doing the freezing of the eggs exactly the same way it should be done without power outages, with people that are trained to do that, your fresh eggs and frozen eggs might, to an extent be almost the same. But somehow, fresh egg has some advantages. Frozen egg also has some advantages and some disadvantages. But the fact remains, frozen eggs can work, fresh eggs can work. But this is what I will tell you. If you are older than 35, please think about freezing your eggs. If you are in your 40s and you were even lucky and blessed to have some eggs, freeze some eggs. Freeze the embryo. If your partner is not in the same location, so IVF is also an opportunity for partners that have distance problem. Let me tell you how. If your partner is in America and you're in Nigeria and he normally comes every December, and for some reasons he wasn't granted visa or immigration status kind of had problems, but he visited and he stored his sperm in a very good lab, you guys can continue having your babies. So it's important you understand this. So the same way you can freeze your eggs, freeze your embryo, we can also collect good sperm, keep it in a very good lab, then you can go for different cycles of IVF. So you can be in Nigeria, your partner might be in America for 10 years, and you guys can complete your family. That has happened before. So the idea is to make sure you don't have any excuse. Okay? All right. Where are eggs and sperm stored? Special process called vitrification. Special equipment with constant supply of power, specially trained people to store it under a specific temperature, cold temperature. So it's done perfectly. Just the same way you can store a lot of things in your deep freezer and your refrigerator, you can do the same in this instant. So we can comfortably and reliably store the eggs, store the embryo, and store the sperm. Okay? Is there anything that could negatively impact IVF success? Yes, starting from the eggs. If we don't have good quality eggs, then it can start failing from the eggs. The same thing is applicable to the sperm. Now, your lifestyle is very important. If you watch what you eat, if you eat a lot of fruits and vegetables, both for you and your partner, if you avoid stress, if you sleep, if you drink your water, if you avoid your alcohol, if your BMI is good, you are giving yourself a better chance. Now, you have to take all the routine drugs they give you religiously. You have to give the injections exactly the quantity that is needed. So everything must be done to precision. When you do this, you are increasing the possibility of having good outcome. Okay? So if you don't do all this, if you have higher BMI, let's assume your BMI is 30 up, the possibility you have failure is there. Now, IVF can also fail if the sperm is not good, or if you have implantation problem, or if you have anything that will disrupt the normal structure in the body, it can fail. So it's a very careful process. Now, So many people are claiming to be IVF providers. You have to look at the numbers. Data is important. Asking questions. If you go for your first consultation with the IVF provider, have conversation. Ask those tough questions. Please, sir, how many have you done? Let me give you an instance. No matter how good an IVF provider is, you cannot have 100%. You can't even have 90. 8 is even like magic. It fails. Sometimes you do everything right and it will fail. But they have a lot of conversion rate. So they would have done 1,000 and they would have had 600 positive outcome. That's a good place to go. Don't be a guinea pig. So many people are opening IVF centers because everybody is, claiming to be IVF provider. So many people in the internet. So many of them. They are just interested in your money. So do your research. Be very careful. Make sure you ask for your report. Very, very important. Now, another red flag. Anybody coming to tell you, oh, IVF is going to cost you 200,000. That's not IVF. You cannot have IVF at 200,000. There's a specific range. I'm going to have another masterclass to talk about the cost in Nigeria. Okay? There are specific range. Unfortunately, it's expensive. The whole infertility management is expensive. The drugs for IVF is expensive. The equipment for doing all these things, they are all expensive. So unfortunately, it's expensive. So anybody selling you a dummy of coming for 400,000 or 500,000 IVF, likelihood they will take your money and they won't give you any report is very high. So demand your report. All the investigations, all the blood work, all the ultrasounds, have your report. Request a comprehensive report from the IVF provider at the end of the day. When you have your report, you can walk through the stages. We can investigate and see what everybody did and make sure we've done our best. Sometimes you do everything right and it fails, but we want to get it right. Very important. If IVF is unsuccessful, when can one try again? We have to investigate first. We have to look at what we did right, what we did wrong. We have to review. So don't just jump into another cycle without them giving you a report. Let them investigate. You can start as soon as within 1 month, depending on how everything went. So if you have, some people will promise you to come back for a different cycle, but I don't want you to quickly jump into a different cycle if we haven't received the report. Because if we don't correct the reason why it failed, the possibility is going to fail is there again. And we grade the eggs. We look at the sperm, we look at the eggs because they are the most important cells. So if the egg is poor quality, the likelihood is going to give you poor outcome is high. If the sperm is poor quality and you're not going for ICSI, the possibility is going to fail is very high. So the IVF provider will decide the best time to try again. But you need to be involved. You need to be proactive. When you see them, you ask all your questions. Very important. What about single parent IVF? Now, depending on where you live, okay? Depending on what is sustainable there, this is what I tell women. So long as you want to be a mother, use all your options. So the fact you're a single lady and you want to have a baby shouldn't stop you from having your baby. Look, I'm keeping it real as a maternal and child health specialist. I'm not coming in from, morality perspective. I'm just telling you about your own decision. So there are still so many single people. Maybe you had a bad relationship or you got divorced or whatever, and you want to start your family. You can have that conversation. If it's applicable in your location, you can go for it. Okay? You can go for it. There are so many single people that went for donor eggs, donor sperm, and they had their family. So have that conversation. You will have a better outlook if you're living in the developed countries. If you're living in somewhere like Nigeria, there are so many bottlenecks. There are so many cultural, religious expectations. But hey, if this is what's going to make you happy, go for it. Okay? All right. Okay. Very, very good question. Let's wrap up with asking more questions. Okay? The reason why this one extended up to 35 minutes is because it's a very, very important topic. So if you didn't meet the live presentation, you can always come back and review. Okay? Make sure you subscribe to this channel. Please also share with your friends. Click on the notification button so that anytime I come live, you can participate, you can glean from it. And we have so many amazing videos out there. So glean from them, take your bold step. If you have been sitting on the fence about IVF, this is the time I will encourage you to go. Today is the 30th of August. By the time we enter September, it's countdown. Go for it. God is on your side. There is absolutely nothing to fear about. Now, in our group, we have a PDF on IVF guideline. Every single information you need to know, every single question you need to ask before you go there. I love people that ask a lot of questions. It's better you ask than to assume. So make sure you grab a copy of that guide before you go and ask a lot of questions, okay? Okay, Benisa, will a woman lose eggs faster if she takes fertility drug that results in multiple egg ovulating? No. So this is what happens. Remember, you already have your eggs, okay? Now, when we challenge you in a particular cycle, what's going to happen is it's going to go challenge the whole available eggs in that particular sitting. So long as you still have good ovarian reserve, there is nothing that will happen. And the younger you are, the more your eggs will be there. But if you are older, if you get to 35 or you're getting to 40, matter of fact, if you're at 40, we generally advise you to go for donor eggs because at 40, the possibility your ovarian reserve is reduced is high. So we normally advise women going for IVF about age 40 to consider donor egg. But if you're younger, once that super ovulation happens, you're good. When we want to go for another one again, you have enough, you have enough stock to go for it. So there is nothing to worry about it. But the key determining factor of what you need to do is your age. Once you are old, once you are advanced, you need to act fast. We don't have a liberty of time when you are old. Okay? Now, when I mean old, everybody is going to age. I'm talking about medically old, medically advanced in maternal age, which is defined as women above 35 years. Once you get to 35 years and you're planning to become a mother, you are classified as advanced in maternal age. Okay? So thank you so much for coming. I want to believe I've attended to all the important questions. Ebenezer, thank you so much. Can you quickly share the topic for tomorrow before we go? Please quickly share the topic for tomorrow. Click on this video. Share this video with your friends. If they are sitting on the fence, remind them to pray, to play, and practice all the time. Okay, tomorrow we're actually going to talk about the cost. So we're going to do cost analysis of IVF in Nigeria. So this is a topic you don't want to miss. So you want to attend, you want to get your numbers right, then you want to start planning. I believe in life, no matter what you want to achieve, no matter how expensive it is, if you plan towards that, you can do it. And if you have very good social capital, if you have very caring friends, family, uncles, aunties, you can discuss with them. They can loan you money. You can discuss with the organization. You can flip around your home. You can source for money. Nothing is worth more than starting your family. And you might be blessed with twins, triplets, quadruplets, just one go. So you cannot afford to miss this. So I encourage you to go above and beyond. So tune in tomorrow for cost of IVF in Nigeria, the same time, 7 p.m. The reason why we chose 7 p.m. is because when I'm transitioning from my job, when I'm coming home, I have about limited time to get my slides ready, get my presentation ready. So this is about the only time I'm free. But over the weekend, I have a little bit of flexibility. So just pardon me. If you are not able to watch this because you're in Nigeria and it's very late, when you wake up, click on that link, watch it real time, ask your questions. It will always come back to me and I will give you a feedback. Now, do we have any other question? If you have any other question, please feel free to ask before I go. Okay? All right. So at this stage, I'm going to take my leave. Thank you for coming. I'll see you tomorrow. Remember, tomorrow is cost of IVF in Nigeria. Specific cost analysis of IVF in Nigeria. So if you're planning to go for IVF in Nigeria, I'm going to do my little research and give you a kind of estimate of the amount of money you should be saving towards going for this. But by any means, go for it. God is with you. Remember, if every other thing fails, pray, play, practice. Apply this to all aspects of your life. Pray to God every day, play 48 hourly, then practice. Part of your practice is stepping up and seeing a fertility specialist. Okay, so thank you so much, and God bless you, and bye-bye for now.